What if I told you that many widely accepted ideas about masturbation aren't actually true? In this video, we're going to explore why self-pleasure plays an important role in women's sexual health. Let's begin by looking at some of the most common myths. Myth number 1. Masturbation is rare or unnatural for women. The reality is, research shows that masturbation is very common among women. In one large survey, up to 94% of women reported masturbating within the past 12 to 24 months. Similar findings appear in many other studies, and on average, women reported masturbating about once a week or once every couple of weeks. Myth number 2. Women only masturbate using dildos. In a study of over 2,000 women examining their habits, 97% said they used clitoral stimulation, which means a dildo isn't necessary. Only about 45% reported vaginal stimulation, such as inserting something. Around 41% used erotic aids, like watching or listening to something stimulating, or even using a mirror. And 39% relied on sexual fantasies, often involving a partner. So no, most women aren't always using dildos. They often use other methods, including their own hands. Myth number 3. Masturbation replaces a partner. Looking at that same study, when women were asked their main reason for masturbating, fewer than 10% said it was due to a lack of sex with a partner not wanting sex, or feeling unsatisfied in their relationship. In fact, women who masturbated more frequently also tended to have more sex with a partner. The only exception was women who didn't have access to a partner, either because they didn't have one or their partner wasn't interested, so naturally, they reported more solo activity and less partnered sex. Even among women who were not fully satisfied with their partner, those who masturbated more still tended to have more partnered intimacy. In simple terms, for most women, masturbation fills in the gaps. It doesn't replace a partner. And overall, women with a higher sex drive tended to engage more in both solo and partnered activity. In other words, they want both. Myth number 4. Masturbation is harmful or addictive. There's no scientific proof that masturbation is physically harmful or addictive. In fact, studies suggest that it may offer several positive benefits. So what are those benefits? Masturbation can have positive effects on both physical and mental well-being. It may help relieve stress. Masturbation and orgasm release endorphins, which can lower stress levels and improve overall mood. It can also support better sleep. After orgasm, the body naturally relaxes, which can help women fall asleep more easily. Pain relief is another benefit. Some women report that masturbation can ease discomfort, especially menstrual cramps or even headaches. It can also improve body image. By becoming more familiar with your own body, you may feel a greater sense of acceptance and increased confidence in your sexuality. Finally, it can support overall sexual health. Regular masturbation increases blood flow to the clitoris. Now, if you're not masturbating, it doesn't mean your clitoris won't stay healthy. Your body naturally maintains it, even during sleep. But masturbation does boost circulation to the genital area, which can be beneficial for normal function. It's important to understand that everyone's relationship with masturbation is unique. There's no right or wrong amount. It really comes down to how you personally feel about it and what feels comfortable and healthy for you. If it doesn't feel right to you, then it's not right for you, because your perspective matters most. Research also shows that women who have a more positive view of masturbation tend to feel more comfortable in their bodies, have a stronger sense of control in intimate situations, and communicate better with their partners. On the other hand, women who see masturbation negatively may start to view their bodies as belonging more to their partners than to themselves, which can lead to unhealthy thoughts about sexuality. That's why developing a healthy and positive connection with your body is so important, and masturbation can be one way to support that. Myth number 5. Masturbation makes it harder for women to orgasm with a partner. In reality, studies show that orgasm satisfaction is often higher in women who masturbate more frequently, especially those who are older and have fewer difficulties reaching orgasm. These women also commonly report that pleasure is their main reason for masturbating. So if someone enjoys self-pleasure for the sake of feeling good, it may actually lead to better experiences during partnered intimacy as well. Now, there is one exception, and I've mentioned this before. If you're relying on a method that a partner simply can't recreate, like strong vibration, it can make a difference. A mouth or a finger just can't match that same speed or intensity. So if that's the only way you reach orgasm every time, it might be harder to do so with a partner unless a vibrator is involved. That doesn't mean you have to change anything. If you want to, you could take a break from using vibration and see whether your body becomes more responsive to other kinds of stimulation. On the other hand, you can also invite your partner to bring a toy into the bedroom and use it together, which can be both enjoyable and exciting. When it comes to orgasm, higher levels of difficulty are often seen in women who masturbate less frequently, as well as in younger women. These women may feel less satisfied in their sexual relationships and often use masturbation more to ease anxiety or release tension, rather than for pleasure. It's also important to remember that masturbation habits vary widely from person to person. In one study, researchers grouped women into 3 main categories based on their patterns. Type 1 included about 731 women who were very sexually active. They both masturbated and had sex with partners regularly, placed a high value on intimacy, felt satisfied in their relationships, and usually reached orgasm easily and with enjoyment. Type 2 included 587 women who often had sex with partners but rarely masturbated. They also valued intimacy and were generally satisfied, but compared to the first group, they had a bit more difficulty reaching orgasm, took longer, and often found it slightly less pleasurable. These women also tended to use masturbation more for stress relief than for enjoyment. The third group included women who masturbated more frequently but had partnered sex less often. They tended to place less importance on sex overall and felt less satisfied in their relationships. For them, masturbation often helped make up for less fulfilling experiences with a partner, and that's completely okay. Not every woman fits neatly into one of these groups, and you may find yourself in different categories at different stages of life. These are simply general patterns, not strict definitions. What they show is that masturbation can affect women in different ways and can serve different purposes, but it doesn't replace a partner, and it isn't harmful to the person engaging in it. Alright everyone, I hope you found this video helpful, and as always, take care of yourself because you truly deserve it.